Setting: hospital ward. You are speaking to the daughter of an 80-year-old woman who had Bunion surgery 3 weeks ago. The patient will be in the doctor's care for the 6 months recovery period. Now let's look into the task. First one says, find out how prepared the daughter feels about their mother's discharge to their home. Explain the mother's need for the first 8 weeks. Non-steroidal anti-inflammatory drugs, painkillers, dressing change, mobility exercises, personal hygiene and meal preparation. Third one says, reassure the daughter that it is manageable and give advice and strategies which will make caring for her mother easier. That is, set up routine, get a medicine organizer, ensure that she has everything she needs nearby, then wear surgical boot. Fourth one says, explain the role of the surgical boot. It protects the foot, prevents infection. Fifth one says, explain the painkillers and anti-inflammatory drugs. 1 naproxen painkiller and anti-inflammatory every 12 hours, ibuprofen for every 4 hours. Not to exceed 8 per day. Now let's start the role play. You can start like, good morning, I'm Tina, the registered nurse working in this hospital ward. Am I speaking with Sarah's daughter? Then interlocutor may tell you like, yes nurse, good morning, I'm Catherine. Yeah, she's my mother. Then ask her, okay Miss Catherine, how is your mother? Then interlocutor may respond to saying, she is much better now. Then responder saying, I'm really happy to hear that. As you are aware, your mother is going to get discharged today. Moreover, I came to know that she is going to stay with you for the coming 6 months. Am I right, Miss Catherine? Then interlocutor may agree with that. Then responder saying, I appreciate your great decision, Miss Catherine. Do you know how long it will take for your mother to recover? I would also like to know how well you are prepared to take care of her. Then interlocutor may respond by saying, nurse, doctor told me that she needs at least 6 months for a better recovery. However, I am not really sure regarding the level of care which needs to be provided to my mother. Then responder saying, your concerns are really understandable, Miss Catherine, but don't be overly concerned. I can provide you with a clear picture regarding the care. Is it okay with you? Then interlocutor may agree with that. Then continue by saying, okay, Miss Catherine, first of all, let me tell you that the first 8 weeks are really crucial as she requires proper and continued care. During that time, you need to assist her in her mobility. Then her dressing needs to be changed daily. Also, you need to assist her to take the non-steroidal anti-inflammatory drugs. It is also important to give her the painkillers and other medications as prescribed by the doctor. I hope you're following me. Then interlocutor may agree with that. Then continue by saying, in addition to that, it is also important to prepare nutritious meal rich in protein and calcium for your mother. Moreover, never forget to maintain personal hygiene. Are you following me, Miss Catherine? Then interlocutor may ask you, yes nurse, I understand that, but I'm a little worried now because what if something goes wrong? I mean, if I make a mistake, how can that be managed? Then responder saying, your worries are really understandable, Miss Catherine. Nothing to be worried about as it can be well managed through certain measures. Don't worry, I'll explain you everything in detail. That is, I can help you to take care of your mother by providing you certain strategies and solutions. Is it okay with you, Miss Catherine? Then interlocutor may agree with that. Then continue by saying, I'm happy to hear that. Having a routine is the first thing you need to do. First of all, for example, keep a medicine organizer near to your mother's bed. As the name suggests, it is a tray that organizes your medications into separate compartments, showing when and what should be taken each day for your convenience. Each box contains a week's worth of medication with a clear label that reminds you when to take the medications. So it helps you to take your medications correctly on time. Apart from that, maintain everything nearby so that she always has access to it. It's really important that she wears a surgical boot. Miss Catherine, I hope you are with me. Then interlocutor may ask you like, yes nurse, do you think it's really necessary to wear surgical boot? The responder saying, yes Catherine, it is highly important that she wears a surgical boot because it is going to assist her in healing faster and also prevents any kinds of infections. Is there anything else to be clarified, Miss Catherine? Then interlocutor may ask you, nurse, I would like to know more about the medications, its dosage and frequency. Then responder saying, that is a sensible question, Miss Catherine. I'm happy to explain that to you. I hope the doctor has already prescribed painkillers and anti-inflammatory medications, out of which one naproxen tablet need to be administered every 12 hours and 2 ibuprofen tablets need to be administered every 4 hours. Nevertheless, you should not exceed 8 tablets of ibuprofen per day. I hope you are following me. Then interlocutor may agree with that. Then ask her again, do you have any more questions for me? Then interlocutor may tell you like, no, Miss, thank you very much for your help. Then we can wind up the roleplay by saying, okay, Miss Catherine, I would like to recap what we have discussed. We have been discussing your mother's post-operative care and medication compliances. I hope you understand that. If you have any more questions or concern, you can get back to me at any time. I'll be glad to help you. So thank you, Miss Catherine, for listening to me patiently. I wish your mother a speedy recovery. Thank you guys. Our roleplay ends here.